Okay. Hello everyone, and hope it's a great Saturday for you all. Welcome to the final technical session of CLC 1, Supply Chain for Health, jointly organized by the Association of Industrial Pharmacists of Nigeria and B-Skill. Um, I believe by now a lot of you have already either finished the course entirely or very close in finishing the course on the platform. This session was supposed to happen last week, but unfortunately, we were a bit unavailable, so we had to reschedule it. Also, we had initially invited Mr. Taqir Ahmed from Plan International to come join us and talk about a case of outsourcing in India. However, he sends his regrets. He is stuck somewhere and he just couldn't join this session. So it will be myself taking this session. I have some information which Taki has shared. So I will be talking about it briefly at the end of the session because it's important to know what's happening worldwide. Um, we have a good amount of people joining. Just a sec. Okay. All right. We have a good amount of people joining. I was just waiting for a few more people to join because I wanted to also announce this interactive talk that we are organizing. It is scheduled for 25th of August. So all the strong women who are part of this cohort, I would really recommend that you join this talk. Registration is free of cost. The link is provided on the screen. The objective of this talk, there are multiple things happening, but the most important is we are launching a new community for women professionals across the globe who are working in public health or global public health. The objective is to support them, guide them towards leadership roles. And this is the inaugural talk that will underscore the importance of the women workforce in health and how together everyone can learn from each other and plan their careers towards leadership. We have a great panel, as you can see on the screen, and there will be someone from Nigeria as well launching the community. All these faces that you see on your screen, they are leaders in their own, in their own context, and they have been paving the way for all young professionals for a long time. So it will be great to hear them and also understand the new community. So I really recommend all women professionals part of this cohort to join this talk. We will be sharing. We have already shared the links on WhatsApp, but if you have not noticed it, please go check it out and join this talk to happen on 25th of August. Okay, and I will talk about it briefly at the end as well. Okay, so before I introduce today's session, I would again like to emphasize the fact that the course is going to finish by 20th of August. So if you have not completed it yet, so please do it in time because uh, your certificate, first of all, is dependent on completion of the course. Also, we have now fully received the approval from Pharmacy Council of Nigeria that all pharmacists or pharmacy technicians who are registered with them, they will receive 5 credit units, from the MCPD credit units from PCN, which will be directly sponsored by us. So you would not have to pay anything to PCN for that. And then we are also in discussion with PCN to see if they can allocate more credits to this course, which you can submit the fee to PCN and they can allocate those credits to you based on your completion of this course. So that discussion is going on, and we can inform you whenever it concludes. But what has been agreed is that 5 credits will be allocated to all of you once we submit the list of all participants who have successfully completed this course. Uh, the representative from PCN, they have also reviewed and audited this course, and they have really appreciated the level of the content which is there, the commitment from our team, and also the commitment from all of you. They have been coming to these classroom sessions as well. They have seen all the discussion happening on the platform, and they have really appreciated the way all of you have engaged and interacted during the course of these last 4 to 5 weeks. So it's great news. So that also means that you have to complete the course on time. Okay. Now, if there are if there are any questions at this point about course completion or the webinar, you can ask, or otherwise, I will start today's session. Please let me know if you have any questions. You can raise your hand. You can also you can speak if needed. Okay, all right. So if no questions, then let's begin. So this session today, it is part of module 6, as I also wrote in the chat. Module 6 was about downstream functions of supply chain, which means warehousing, storage, transportation, and of course, transportation to the last mile. Now, one of the one of the things that are gaining quite a bit of popularity these days is outsourcing, which means getting someone else to do the work that you are supposed to do. That simply means outsourcing. But in the case of supply chain, the use of third-party logistics agencies are increasing day by day because of their specialized nature of services. And today we are going to discuss what are those things which can be outsourced, what is the process which you should follow before considering outsourcing any supply chain function. We will look at some case studies, and of course we'll also look at the case study from India, and then there are some questions, polls, and you can also ask questions to me about this topic. So let's begin. So what is outsourcing? As I said, outsourcing is when an organization, it contracts out mostly non-core processes or operations, but sometimes some organization also contracts out part of their core processes as well. But in general, the idea is to contract out non-core processes, operations, mostly less critical work, services, or projects to the best placed third party or specialized firm. So generally, it goes through some kind of a procurement process, procurement for service, of course, and whoever is the best possible firm that comes out on top, they are given that job to manage that non-core process. Okay, so that is simply what outsourcing means. There are various categories of outsourcing. Excuse me. There are various categories of outsourcing depending on what is being outsourced. Now, as you see on screen, there are several things that can be outsourced, and like not just functions, but depending on uh, you know depending on the areas of work. So in this case, it can be a process that is being outsourced. Hardware, IT outsourcing doesn't necessarily mean software outsourcing, but it can also mean hardware outsourcing. Knowledge process outsourcing, KPO. So if you know about call centers, so that's part of knowledge process outsourcing, where there is a knowledge and a customer service that is linked to it, that is outsourced to a company who manages that, dissemination of knowledge, or dissemination of, or management of customer service on behalf of a company. There is operational outsourcing, which simply means there are certain operations, company operations, which are given to a third party. There can be a project which is outsourced, and this is very common in our sector, where UN agencies or multilateral organizations or international NGOs, they outsource some of their projects to some specialized entities. Okay, there can be professional outsourcing, where experts or professionals in certain areas are asked to carry out certain work. Okay. There can be manufacturing outsourcing, and this I'm sure a lot of you are aware of, where uh, pharmaceutical products, which are designed by big global pharmaceutical companies, sometimes to manufacture them cheaply, they contract that out to local manufacturers, or they are called contract manufacturing organizations, for example. Then there is something called multi-source outsourcing as well, which means contracting more than one service provider. And this is generally for large projects or large schemes. For example, a large stretch of road has to be built, so one provider can't do it. So the government or the party responsible may contract out two or three different organizations to do that. Similarly, it can also work in large scale transportation outsourcing, which I will cover when I talk about the India case study as well. It also has a point in multi-source outsourcing. So like you see here, the different ways outsourcing can be done. Different things can be outsourced. So let's now look at uh, what are certain issues that public sector organizations face, and why it can be advantageous if those things, if they're outsourced, will work better. Now, before I talk about this slide, the way it is written, we may have to probably change it. But I'm not trying to say that if you are facing an issue or a problem in your place of work, in your system, if you outsource that, your problem will go away. It doesn't work like that. It simply means that if your organization has some sort of disadvantage that can, hamper your work, so you may need to find some specialized organization who can look at that disadvantage and can work with you to solve the problems that arise because of that disadvantage. Okay, now let's look at these examples, and I will explain what I mean. So there are several times in public sector that there are lack of in-house expertise, or there is a high turnover of employees. And both these things are also quite applicable to Nigeria. And if someone has any example to attest this, please do not hesitate to share. So what outsourcing can do is that it can help that organization get access to specialized expertise. Okay, for example, technical assistance for warehouse management, or developing training plans. These kind of expertise may not be, inherently present in government organizations at a state level, for example. So there you may need technical assistance. Then there may be limited resources available, or the need that is for any specific need, it is very temporary. It is not required all year round. So if you put a full-time staff, that may not be necessary, because Once that need is done, what is that staff going to do? So in those cases, whenever that temporary need arises, or if there is a need and you have limited resources, rather than look for people, you can look for an organization who can manage that issue for you. So, for example, expansion of services without investing in infrastructure or staff. For example, developing activity-based costing or creating accounting module. So these are temporary needs that can be managed with outsourced providers. Then also comes limited volume, and this is quite common when it comes to transportation. So if there is a state, let's say a state in Nigeria, which is a very small state, and the amount of pharmaceutical products that is transported within the state is quite low, then instead of doing all of that themselves, they may think about outsourcing, because that may be much more cost efficient for them. Okay. There can be variable demand. So in some point in time, the demand is very high, and then some point in time, demand is very low. And over there, third-party logistics system or outsource providers can help you. And then finally, inefficient service delivery. So if in transportation, you are not able to manage the service levels, if you keep getting stockouts, or your supplies don't reach in time because you're not expert in that, so that is where then you may need some specialized organizations to manage that task for you. And that is where outsourcing becomes advantageous. Now, however, on the other side, uh, and we will look at this in the upcoming slides as well, that if you have a systemic problem, like for example, if your warehouses are not efficient, or if let's say your procurement is not efficient, and that is the root cause, while you invest in third party logistics to transport your products, you will still face issues, because the root cause lies somewhere else. It is not the transportation that is the problem. So even if you think that having a third party logistics provider will solve your stockouts issues or inventory issues, it may not be the case, because the issues lie somewhere else. So that's what I meant initially, that if you try to outsource your issues directly, it may not help. You may have to dig deeper in understanding why outsourcing is needed and where outsourcing is needed, and then go for it. And we will discuss it more in detail in the next slides. So this is what I was trying to say when the question is that is outsourcing recommended everywhere? Okay, so not everywhere, but depends on your need, depends on what is it that you're struggling with, and whether outsourcing in that case will solve that problem or not. Okay, let me quickly see if there is any activity on chat. No, okay. So today we have a bit less number of people than the other classes. Maybe since this is the last one. Okay. Now let's see which are the categories of health services. Now beyond supply chain, what all can be outsourced. So as a uh, as in health services, there are different areas of work that needs to be done, and almost everything can be outsourced depending on the focus of the organization, depending on the manpower that the organization has, and depending on the objectives of that organization. So as you see, number three, supply chain is also here. Okay, so supply chain can be outsourced as a whole or by function. Okay, it really depends on organization and how the health system is designed in your state or in country. Okay, so from health information technology to data management to surveillance to research to financial management, monitoring and evaluation, almost everything can be outsourced. Okay, what is important here is to understand what is the core area of services for any organization, what they are good at, and what are the areas which are non-core. And that is where outsourcing actually works best. So that as an organization, you focus on your core activities, and anything which is a non-core activity for you, you hand it over to an outsourced agent and just monitor their performance. And instead of having a large number of staff do it without being that task a core activity, have one or two people just manage that with a specialist organization or a group of people who do that, who work on that area day in and day out. Okay, so that needs to be understood. But this slide, what we're trying to say is that almost everything can be outsourced. What is important is to look at whether it is a core area or a non-core area, and what will be the benefits of outsourcing. Let's look forward. Outsourcing can also be decided based on risk. Okay, and again, we are here talking about health systems. Now, if you see supply chain, it comes under non-clinical services. It's very low risk. Okay, as we go towards more patient-facing clinical services, the risk becomes higher, and that's why I keep on saying, what are the core services of health system? So, if you ask me honestly, whether supply chain in health, whether it is a core activity or a non-core activity, I would say supply chain is a non-core activity for health system. Okay, because the objective of any health system is to manage patients, is to manage diseases, is to manage any kind of outbreaks. Of course, diagnosis is part of patient services. So that is where the focus of health system, the core objective, or the people who work, their core education lies there. Supply chain kind of becomes a non-core activity, and that's why you see a big disconnect when it comes to supply chain as to who should handle it. And I think we had a discussion, if I'm not wrong, in the first session, where we were discussing whether supply chain in health should be managed by pharmacists or should be managed by anyone else or any non-health professionals. Who should manage it? The reason why these discussions come into being is because in health system, supply chain actually is a non-core activity. Okay. The reason being, people who are involved in health system, they don't study supply chain. Supply chain never features in most of globally. In if you talk about, especially if you talk about low and middle income countries, it never specifically features in government's budgets, or even in university curriculums. Okay, so looking at that, it becomes a non-core activity. But even if it is a non-core activity, it has a big impact on how health services, uh, you know, how health services are managed. Because if supply chain doesn't work properly, then people who are managing health services, they will struggle because they would not have the right products in hand, and they will and patients will lose faith in the system. So it is a big debate everywhere, and not just in low and middle income countries, but also in high income countries, as to who should be managing the supply chain of health products. Should it be, and of course, when it comes to high income countries, there the private sector is quite strong. There the hospitals are looking at this uh, as a core or non-core activity rather than governments. But in countries where the public sector is stronger, this discussion is for the governments to discuss whether supply chain is a core activity for them or a non-core activity, and whichever way, who should be managing it. Okay. So moving on. Now let's look at the cycle of outsourcing. So how should it be managed? Okay. So the first thing to begin with is a strategic assessment, which I, I kept on talking about earlier, that one, whether what you are trying to outsource, whether it is a core activity or a non-core activity? Why do you want to outsource? What is the objective of outsourcing? Who will do it? Do you have players in the industry who can do it for you? So that's an assessment, internal, external, and I think there are a couple of more slides on that. It also links to point number two, which is needs analysis. Again, understand the needs of the organization on that particular point. Based on that, assessing the marketplace, that who will do it, then going through a bidding and contract management phase. From there, you start the project, you manage the relationship with your vendor, you keep on monitoring the project. Either you continue the project after the duration has passed, or you exit with that supplier if their performance is poor, and then you start the process again. So it's a typical procurement of service life cycle for any outsourcing project. Okay, but it should be well thought out. It should be well planned. Okay, it should have a detailed market analysis, assessment of needs, so that you know exactly what you're trying to do, how will you manage it, and who will do it for you. Okay, so the question again comes, uh, now if we talk specifically about supply chain, because earlier we were talking about health system as a whole, where supply chain was one part. Now, if we now funnel it down to supply chain, so what within supply chain can be outsourced? As you see on screen, custom clearance can be outsourced, freight forwarding can be outsourced, procurement can be outsourced. A lot of people you may not have seen in Nigeria procurement being outsourced, but trust me, in a lot of places, procurement is something that is outsourced to specialized agencies, and it is used as one of the tools to reduce corruption in procurement. Because it is a known fact that public procurement all over the world faces a big issue of corruption. So in a lot of countries, in some departments, public procurement is outsourced to private organizations, and they are bound by very transparent and strict laws on transparency and weeding out corruption, so that any government employee cannot influence the outcome of procurement, and they don't the money flow is very transparent. So that's why they outsource that as well. One of the common outsourcing functions in supply chain is warehousing, full or partial, depending on what is needed. Uh, Transportation is very common. Security of your warehouses or facilities is very common. So these three are very common practices or functions which are outsourced. Information management can also be outsourced. So who's collecting the information? Where is the information stored? And how is the information processed to aid decision making? So these three things comes under information management, and in many cases, in many places, in many countries, this is also outsourced. And as you see on screen, transportation, in-country transportation is one of the most common functions in supply chain, which is outsourced. Okay. Now, I think there is a poll. Yes. So I would like to hear from you at this stage. So which supply chain function in Nigeria is most commonly outsourced? The poll is on your screen. I would request if you look at it and choose the most common function which is outsourced in your country, in your organization, and then we can have a discussion on it. In the meantime, we can also break for a quick Q&A. So if you have any comment, any question, any clarification, please don't hesitate to speak out at this stage while we are going through the poll. Yes, Sam is saying incomplete transportation. Yes, okay. So there are about 24 participants today, right, or at least right now. I've received 14 responses, and with Sam on chat, 15 responses. So few more, please. If you can look at the poll, because this also shows me who's paying attention. Huh? If you're not paying attention, you don't know whether there is a poll on screen. So please do respond as quickly as possible. Um, okay, Sam is saying few participants because of public or private. It doesn't matter. You can suggest based on your own situation. It can be public or it can be private. Whatever that you have seen is most commonly outsourced. Okay, I don't think any other responses coming. So let's share it. So like I have said earlier, and also evident from the result of this poll, in-country transportation is the most commonly outsourced function in Nigeria as well. Okay. Um, and there is a reason for it because transportation requires quite a bit of uh, what we call capital expenditure because you need to purchase trucks and that's a heavy investment. And those vehicles, they are a depreciating asset. So you also need to replace them after a few years. So that is a big capital expenditure. But then you also need to recruit drivers, and it is very difficult to manage drivers. You also need to continuously fuel uh, those trucks, and you also need to invest in maintenance of those trucks or vehicles, whatever that you are using. So it's a very heavy operation, and we generally call it fleet management. So fleet management is not simple. It's a very difficult thing. Okay. Hence, we see all across the world, in-country transportation is one of the most outsourced function in supply chain. Okay, because also the risk is passed. Yeah, absolutely. Um, although it really depends on how your contract is organized, Dr. Alibisola. It really depends on how your contract is designed. See, one of the things that we all should understand here that even if you are outsourcing any function of supply chain to a service provider, the final accountability still lies with you. So, from the perspective of the patient or a consumer, they don't care who got those products to the facility. For them, it is the government who's managing it. Okay, so they are going to blame the government only. So if there is a problem and the government blames the contractor, that's not really a way to go. The government or the organization who is outsourcing still bears the ultimate accountability. Okay. So risk has to be defined. What you mean by risk? Yes, there are certain risks which you can pass to the provider, but the ultimate accountability will always remain with you. Okay, and then you can also have insurance. So that is something you can use to manage your risk. Yes, Doctor, you raised your.
Well, what I meant was that in Nigeria is a very peculiar situation because moving goods from, let's say, Lagos to Abuja, for instance, there's so many. I'm actually talking about the risk of the moving the goods on the road. So many peculiar things that
Yes.
are within the Nigerian context. So that was what I meant.
So you mean security rather than risk.
Security, okay. Security, yes.
Yeah. So there is the different words and they have different meaning. So when you say risk, it becomes something else actually. But actually, what you're trying to say is security. Yes, absolutely. When you outsource, and if you know that the uh, the geographical coverage from where the product has to go from is an area where theft is quite likely, there is some sort of domestic terrorism which is very prevalent in Nigeria, then you may organize those contracts in that way. That the provider must also organize security arrangements so that the goods, the shipment, uh, is it gets secured. So it's a matter of security, and then of course you don't need to invest in that security arrangement by yourself. I'm sure depending on the country, in Nigeria there will be many players who have existing security measures which they can of course easily provide to health services as well. Sam is asking who bears the risk in any supply chain. In most cases, the ultimate risk is of the organization who is outsourcing. So let's say if it is a government agency. So let's say, for example, uh, from a public uh, from a public health supply chain, let's say an LMCU or a DMA, for example, if they outsource, uh, the transportation of products within the state, the ultimate risk or accountability is still with the DMA. It is not with the provider. Yes, there are several ways in distributing that risk or managing that risk. Where, like I said, uh, also like doctor mentioned, having security as part of the contract, having insurance, having a proper performance indicators with your supplier. Those are certain measures that you can put in the contract to manage risk. Having said that, it is always with the organization who's giving out the contract. Okay. Sam, your earlier comment about procurement, outsourcing of procurement. I was talking about this earlier as well, that many countries they are outsourcing procurement because uh, that helps in weeding out corruption. Someone tried to unmute and speak. Please, if you wanted to speak, um, please do that. I didn't catch the name, but someone tried to speak. Okay. No. All right. Okay. Okay, so if there are no further questions, we can quickly move to a. Okay, there is another question. Patam is asking there is a difference between outsourcing and subcontracting. Okay, so outsourcing is when procurement bears the risk in outsourcing. All right, Aluchi, I'll come to your comment, but first, yes. So outsourcing is when, let's say, let me give a very simple example. So let's say I am supposed to write a report, okay, and I outsource that work to you, Pattern, okay. So it's my work, but I am outsourcing it to you so that you would do it, give it back to me, and my work is done. Okay. Now, if you give it to someone else, that becomes subcontracting. Okay. So the work is still mine, which I give it to you, but you give it to someone else. Eventually, it comes back to me only, but it has been done by another third person or rather a fourth person, so to say. So that is subcontracting. Subcontracting is when, let's say, in real world, let's say there is a bigger piece of work and one organization is finding it a bit difficult to manage. So they can bring in additional organization on expertise and they agree with the client that, there is a part of the work where this organization is more suited to do the work. And then the contract is not given by the primary client. So I am not giving the contract to the third person. It is rather the outsourced provider, the first level provider, who is issuing the contract to the third person or the fourth person or whoever that is. Okay. Do you understand the difference, Patham? Okay, excellent. Now, Aluchi says procurement bears the risk in outsourcing. I'm sorry, Aluchi, I couldn't understand your comment. Um, if you want to speak, that will be much easier. Then I can clarify because it's a bit difficult to understand whether you're talking about procurement or you're talking about risk. Oluchi? Okay. All right. So maybe if you want to clarify your comment, we can revisit it later. Now let's quickly go through a global case um, of World Food Program. Okay. So I'm sure everyone of you know World Food Program. They received a Nobel Peace Prize a couple of years back. They are one of the largest humanitarian agencies in the world, and their core mission is to distribute food and nutrition products in areas of crisis. Okay, so that is what they do generally. Now they also do other things, but food and nutrition is their core objective, and the name also suggests it's a food program. Okay, now so World Food Program works across the world. They have a very large operation. They utilize 5,000 trucks globally every day. So it's not week, it's not month, it's every day. However, out of those 5,000, they only have about 800. Now, this data is about 4 or 5 years old. Today, maybe it may be a bit more because there are new conflicts that has risen in the last 3 or 4 years. So, but whichever way, they only have about 10% of those trucks which are owned by them. Rest everything is provided to them by service providers. Okay. Now they have been doing this for many years. Okay, and they're very successful. World Food Program, they have one of the most efficient supply chain operations uh, globally for any public sector organization. Okay, they have a very strict way of organizing this outsourcing of transportation, where they look at the market of the local country where the operation has to be based. They organize these pre-qualifying system where they pre-qualify 3 or 4 players, and then depending on need, they simply organize a contract which is based on weight. So because it's food, so they can do it by weight. So it's simple by weight and by miles. So that's how the contract is organized. And that gives them flexibility on how they want, those products to be transported all across the country or whatever the geography in question. So, like it says on screen, they organize these RFQs once their pre-qualification is done. It's done per metric ton, like I said. Contracts are issued for 6 to 12 months period and then reviewed based on KPIs and then renewed again if need be, or given to different service providers. Okay, competition is encouraged. They often have multiple providers for the same route, depending on security, redundancy, amount of product or volume of product being transported. And by doing this, they have built a positive and long-standing relationship with the private sector and the local service provider. And they are one of the very few organizations with having the cheapest quotations for transportation. But of course, they have a high volume, so they can do that. But it also depends on how you organize your procurement. Okay, because they have huge competition of service providers trying to get their contracts. So that's why they get very good pricing, and they're very efficient in managing those service providers as well. So this example is just to show that outsourcing in transportation can be managed really well, and it can work uh, really well in certain circumstances where there are multiple private sector providers. The organization who is contracting out knows how to do it, and they have a very good monitoring and evaluation system, and they have a very efficient procurement system as well. Okay, so we all of us must learn from World Food Program, and if need be, organize these in-country transportation system the way World Food Program does. Okay. Okay. So after after learning from World Food Program, we come to this section where we are trying to understand when to consider outsourcing. Okay. Like I was talking initially, there has to be some sort of strategic assessment and needs analysis. So this slide is based on those 2 points, which I discussed initially. So as you see on the left side, there are 4 broad points, which are then explained on the right-hand side of the slide. So to start with, like I've been talking about, I may have said this 10 times, what is the core competency? So need to understand the core competency of the organization. So even if it is a supply chain organization, so within supply chain, what is the core competency? So here we can ask, is managing transportation our core competency, or do we have experts who can manage entire transportation? Do we have equipment and resources to manage the transportation? Depending on the answer, then we can look at outsourcing. The second is the operational processes. We need to review our operational processes, how we are doing in all the different supply chain processes and where we are lagging behind. Okay. And more importantly, the areas of the processes where we are lagging behind, if we outsource those areas, will that lead to improvement in performance? Because if outsourcing doesn't lead to improvement in performance, then it is of no use. The entire point of outsourcing any function is so that we can improve the performance of that function. Okay, so that's number two. Number three is ability to manage the vendor. So it is not just to select a vendor, but it is equally important to manage the vendor. And when I say manage, it's about communication, coordination, reviewing performance, managing their payments, and overall managing the contract. Okay. And of course, it includes risk management as well. What if your provider goes bankrupt, for example? So do you have an alternative? So those kind of things. So you should have staff who are well versed in managing relationships, managing contracts, communication, and coordination. So it is also very important. There are many places, many organizations and examples where they go for outsourcing, but then they realize they have no one to manage that outsourced provider, and then they struggle. Okay, because if you give them a free rein, then the provider will just do what they want. Okay, because if you don't impose your contract conditions, then the provider will do based on their own bottom line. Bottom line means profit. Okay, because they are private players. And finally, whether outsourcing is technically and politically feasible. Okay. So it is very important to understand whether politically it will make sense. There are certain places where government would want to do everything by themselves because it also generates government job. And in many cases, government may not want to let go of those jobs because of obvious reasons. Okay. And also from a technical point of view, from point of view of skills, governance, finance, so on and so forth. Okay. So these are some internal issues linked with the organization who is trying to outsource part of supply chain. Okay. So these are internal conditions. So these internal conditions have to be discussed, agreed upon, and then external conditions also have to be looked at. So what are external conditions? Three issues. One, analysis of the private sector. You really cannot outsource and find a service provider if there are no service provider in the country. I can give you an example of Ethiopia. So in Ethiopia, it's a more centralized health system and a centralized supply chain, unlike Nigeria. In Ethiopia, the supply chain is managed by an organization called Ethiopian Pharmaceutical Supply Services. They have their own fleet. They are located centrally in the capital in Addis Ababa and in 19 strategic regional centers. Probably it's 18. They keep on changing. It's very difficult to pinpoint because one or two of the centers they are either cross docking centers or sometimes they change it. So let's say 18 regional centers, and they have their own fleet. So from the central warehouse, they use their own trucks to go to the regional warehouse, and the regional warehouse has smaller vehicles to go to the hospitals or the key service delivery points. There are several facilities or service delivery points who also come to the regional warehouses to pick up their products, where those trucks or vehicles cannot reach. Sometimes they may also, temporarily contract out smaller vehicles, pickup trucks, or sometimes motorbikes as well. Okay, so it works like that. Now, the reason why the Ethiopian Pharmaceutical Supply Services, they have their own trucks and vehicles, there is a very key reason about it. So when I was stationed there in 2018 and 19, so one of our partner organizations, they were also funded by the Gates Foundation, and they did a study on why uh, Ethiopian Pharmaceutical Supply Services is not looking at outsourcing. Okay, and one of the key reasons that came into being was the the number of private uh, transport players were limited in the country. Number two, the skills or the operational process maturity of those private sector transport providers were tremendously less than Ethiopian Pharmaceutical Supply Services. So whatever they were doing, although they were also struggling, but they were doing much better than all the private sector players combined, whether in health or non-health. So that's also a key factor in thinking about outsourcing, is that whether the private sector has that capability or not. Okay, if they don't have the capability, then there is no point outsourcing because the problem will still remain. Okay. The second point being cost benefit analysis. So whatever that whatever cost that you're incurring for that particular function, if you outsource it, whether you will get that same benefit at the same price, or if you are able to reduce the cost, so you will have to look at that as well. Okay, and also the benefit, whether there will be efficiency in the process. Like I said initially in a couple of slides back, that one of the key objectives to go for outsourcing is to improve your service levels. So if outsourcing doesn't lead toward improvement in service level, then actually there is no need. Okay. And like I said, process maturity of the companies, the private sector companies, it's also very important. If their process maturity is less than your own, then there is no point of outsourcing. So you have to look at not just internal conditions, like things which are within the purview of the organization, but the organization also has to look at these external conditions before thinking about outsourcing. Okay, you cannot just outsourcing because someone said, oh, outsourcing works better. Okay, so and this has been going around quite a lot of people are saying outsourcing works better without even thinking where outsourcing works better. So that where and why and how questions are very important to ask and answer. Okay, um, let's also do this slide and then quickly break for Q&A. Now, like I said, whenever we think about outsourcing, we also have to think about managing the outsourced providers. Okay, it is not just a sec. It is very important to manage the providers, and I will come to an example from Mozambique in next few slides. Because these outsourced providers are generally private sector players, and their main objective is profit. In public sector, our objective is not profit; our objective is service. okay, is meeting the health outcomes or addressing the health outcomes of our state, of our country. Okay. So outsourced providers have to be managed very carefully. Okay. So whatever expectations we have, the objective of outsourcing, those need to be clarified at the outset from the RFP, in the contract, with agreed KPIs, service levels, all those have to be written down and agreed. And then they have to be monitored throughout the contract period. Also, transparency and communication. These are the two key things to successfully manage any outsourced operation. Okay. So keep in mind that it is very, very important to manage, to be able to manage an outsourced provider. Let me quickly see what's the next slide. Yeah. So before looking at the example from Uganda, let me quickly take a break. And then if you have any questions, clarifications about internal conditions, external conditions, or any example that you want to share from Nigeria, please, I'm going to break for a minute. Okay. Okay. So let's, I mean, if you have comments, questions, clarifications, let's hear from you. Okay. Yes, Dr. Kahinde, please. So if you have a question, you can ask. It's okay. I will respond.
Sorry, I don't have a question. I just wanted to have a look at it again. Thank you.
Okay. All right. Okay. So if anyone has a question, please, or a clarification or any comment or any feedback or any case to share, please don't hesitate. This is I mean, this is a more informational session today. We don't have any group discussion planned for this one because initially we were supposed to have a guest speaker, but that did not pan out, unfortunately. So we did not really plan any group discussion. Otherwise, we would have had another speaker with me. So please, I mean, I'm happy to answer questions, comments, brainstorm if need be, or on any specific issue that you see in Nigeria. Okay, all right. So let's then go through a case study from Uganda. Now, this case study is part of the document which Priyanka shared with all of you. So it's called the Gavi Outsourcing Case Study. It's a great document. It has numerous case studies about outsourcing and not just positive things. It also has some case studies where it did not work out. Okay, so do go through that document. It's slightly old, but it really has some great material to learn. So things like what to do and what not to do about outsourcing. Okay, so I would really recommend for you to go through that, even if you don't go through all the case studies, go through a few of them. And the Uganda one is from there, and let's quickly discuss. So I will not really read what's in the slide because I have kind of memorized it and I have seen it directly happening in Uganda. So this is, I think, from 2014 or 15. At that time in Uganda, they were managing their own, delivery of products. But before that, let's also understand the supply chain in Uganda. So in Uganda, the supply chain is managed by an organization called NMS, National Medical Store. So it's a small country. It's a centralized system. And Uganda has, I mean, if I talk about today, for example, Uganda has one of the best public health supply chain system in that region, so to say. Or maybe if we do a ranking of sub-Saharan Africa, they would definitely be in top five. Okay? So NMS is the central organization who manages supply chain of health products across the country. They have a central warehouse, and that's it. They they don't have any regional warehouses, uh, anything else. But every district has small depots. So it's like a district store kind of a thing. It's not very big, but it's adequately spacious to manage the need for that particular district. But it's not really a warehouse in at a district level. It's literally like a holding place. The products that go to the district depot, they readily are transported from there to the health facility. Okay. So from a warehouse perspective, where products stay for a longer period of time, it's the only central warehouse that they have, okay, in Kampala. Now, until 2015 or 14, NMS was doing everything by themselves. So they used to have sorry, if you're not speaking, then please mute yourself. Yes, thank you. So they used to have their own fleet. They used to have bigger trucks, smaller vehicles, and they were facing a lot of problems with respect to inventory, stock out, so on and so forth. Okay, so they organized a pilot project where they wanted to check how outsourcing will work. I think it was a TA was sought through Gavi or USL, I don't remember which organization, but a TA was sought and a couple of consultants were brought in. And they looked at all the things that we discussed. Okay. And it was decided by the NMS that they will organize a pilot project with a small geography to understand how outsourcing works. So they did that. And they said the transportation from central to district will still happen through NMS fleet because they already had the fleet. And at that point, there was no question of dismantling that fleet, but the issue was coming from district to health facilities. So they said, let's try a pilot where from district, products will be picked up by the contracted players and they will directly distribute it to the health facilities based on the need. Okay, and in Uganda, they also have a very good LMI, by the way. So it really worked like a charm in that country. So when they were deciding for the service provider, they did not go for only one provider. They selected two and also selected a multimodal solution. So multimodal means depending on the geography, depending on the volume of products, the provider was given a choice to either have a pickup truck, so like a small truck or a van. It could be a slightly even smaller vehicle or a motorbike, depending on what. And I think in some cases, I don't remember exactly if they had, but I think in some cases they also had small boats. But there were some areas where they had to cross rivers and something. Okay, so they also had small boats. So it was a multimodal solution which was agreed. And 1 year contracts were given after going through a very good procurement system. So I think 10 or 12 organizations had applied initially, and I think two were selected. Okay. Now, service levels were initially agreed with both the providers, and 5 business days was the maximum limit, which was decided depending on the maximum distance between a health facility and a district store. Okay, so it was the maximum limit, 5 business days. Okay. What they realized in that 1 year of pilot project is that their service delivery improved significantly, stockouts reduced significantly, thefts or skimming of products from district to health facilities reduced quite significantly, and overall the distribution process improved. Okay, so based on that pilot, now in Uganda, if I cut across to 2023, now all the transportation between district and uh, health facilities is done by uh, private transporters. Now, in this case, in the pilot, it was not the entire country. It was a small area, by the way. It was not the entire country. But now, if the entire country, which is managed by private transporters from district to health facilities, also NMS now also has uh, outsourced truck to go from the central warehouse to district as well, if when needed. So as NMS is decommissioning their fleet, they are very cautiously purchasing new trucks because they're also thinking whether that process between central and district can also be outsourced. They're also now in the process of doing that. And NMS is also expanding their warehouse at a central level as well. So they have a bigger warehouse, they have a bigger office because everywhere the needs are increasing because population is rising. And Uganda is one country where patients they get products for free, by the way. So that's another thing. It's funded by government, so patients don't pay. And there is no revolving fund or anything. NMS is managed by the government, but they are constitutionally independent. It's like a parastatal organization, so they manage the supply chain themselves, they manage everything themselves, and they work with the district or the sub-level branches of the Ministry of Health, and they have a very good coordination system. So it's like a best practice which comes from Uganda. It's a small country. Of course, Nigeria is a big country, so if you have to compare Uganda, it has to be some Nigerian state. Okay, and of course, since Nigerian states have complete autonomy over their own supply chain, so a Nigerian state can really go and see what's happening in Uganda and learn from them and kind of try to implement a system the way Uganda has done, not exactly copy it because of course context is different, but try to see how they have done it. Okay. And of course, it keeps on evolving. So the NMS is a very good organization in managing how the need, managing the way the needs are changing for them as well. Okay. So do read the entire case in the document. It's very good. And also, if you get a chance, go and read more about NMS. I'm not advocating for them, but it's just that it's a good system that I've seen in sub-Saharan Africa. As when I was studying supply chain and looking at different countries, different organizations. Okay, so it's a very good example that comes from Uganda. So if you have any questions about Uganda or anything that I've said, please you can ask. The next slide is a question where we can have a quick discussion. But if you have any questions about Uganda, about how to go about outsourcing, and not just in transportation, but in anything else, because I have managed outsourcing of procurement. I have managed outsourcing of transportation. I have managed outsourcing of human resources. So these are the three areas where I have personally supported organization and worked with them operationally, in setting up outsourcing systems. So those are the three areas that I can really talk about. But otherwise, the system is similar. So I can also answer any questions with respect to other areas of outsourcing. Okay. The next slide is a very crucial slide. Is outsourcing cheaper? So I would open the floor for everyone. Please, this is a time to talk about your own feelings, what you think about it, whether you think outsourcing is always cheaper, or in the long run, outsourcing is actually expensive. What's your take about it? Anyone, please, you can just unmute and you can speak. Yes, Stephen.
Good afternoon, everyone.
Yeah, good afternoon.
Yeah, Mr. Sanjay, thank you very much. So I think outsourcing is cheaper because it's a means of cutting cost.
Okay.
And it's
Is that
also a means of accessing specialized talents also. So that's my own opinion.
okay? Great. Thanks, Stephen. Sam is saying outsourcing is very cost effective. But cost effective doesn't mean it's cheaper, Sam. So is it cheaper? So anyone else who wants to take a crack on this question? Maybe the question is not correct. I mean, whatever you think. Yes, Samuel, please. We have been dying to hear from you. Huh?
Yes, thank you, Sir Sanjay. Well, I've been a little bit under the weather. When I
Okay,
even
sorry
sent
to
you
hear.
personal message, you didn't reply. But it's okay.
Okay.
Yeah. Uh, for me, yes, in the short run, outsourcing can be very cheap. I mean, can be very cheap. It's be cheaper. But in
Okay.
the long run, uh, you will also find out that it might not be necessarily cheaper because uh, when you look at it's just unfortunate. When you look at, for example, the company that is doing when you look at it, the FedEx, for example, let's take the Korea company, FedEx, for example. FedEx, the Korea services they offer, if they are not if they are not making, if they're not making uh, so much profit from that services they render, I am very sure that FedEx will not be what it is today. FedEx is multi-billion company, which is a logistic company. And that is because when you look at the long run, the long run effects of what goes into logistics, it's pays the, the agents more than the outsourcer. So for me, yes, it is needful to outsource uh, logistics, particularly delivery, because in first and foremost, we also want to look at the short term and medium term. But because we have not gotten system, and that's the issue, that's a major issue. We do not have functional system. You understand? Majority of time, the public systems are not dependable. This is why you can see, for example, in Nigeria, private refinery is working, but government-owned refinery that has the whole of the money of the country cannot work, cannot produce. So this is the reason why. This is the reason why we won't want to say, okay, let's outsource this. Yes, we're losing something, but at least we're having our services. But in actual sense, when you look at it, it's a business on its own that is profitable, that can bring profit. So if it is done properly, but because the government institution, the system of government do not see reason why they have to make whatever they do a business as a business concern. So it is seen more as okay.
Let me come and bat my hair.
Yes,
I'll come back.
This is sorry for taking your time. So in actual sense, what I'm saying is that in the long run, outsourcing is not cheap. It's not cheaper than carrying out the delivery within the system.
Okay. All right. So what in a nutshell, what Dr. Samuel is saying is that outsourcing may be cheaper in a short term, but in a long run, it really has to be monitored because it may not be cheaper. Let's hear from other colleagues who have raised their hands. I will call their names one by one. So I think the first one is Dr. Olubake. I think you raised your hand first, so please go on.
Yes. Well, if you're looking at it in terms of cost, right? I mean, I will agree with Mr. Adekola. However, if you're looking at it in terms of the overall business and the functionality of the business, then it might be cheaper because you don't, like you have said, you don't really want the headache in some things that that would impact on the day-to-day running of the business. So there's a cost benefits issue to be looked at in the long run.
Yeah, that's absolutely correct. Let's hear from other colleagues. I think the next is Madam Adi Folake. Please, you have raised your hand. You can, yeah.
Okay. Good afternoon. Thank you, Sanjay. I want to look at outsourcing from the angle of cost saving. If like you need to buy an expensive equipment, I'll give an example of the hospital where I worked. We had this dialysis unit and we were having challenges with maintaining the machines that we had. So the management decided to outsource it. We had the personnel to run the machines. So the outsourcing was just for the person to bring in the machines. And there was an agreement, payment schedule, how they will be getting paid, maybe 50 to 40. So it was, and we started having more clients because we had the equipment to work with. We had the staff, so it was just a matter of equipment. So on the hospital really benefited from it because we were able to get some, that was another income source for the hospital, and we were making money. We didn't have to bother ahead about maintaining the machine, whether it had issues or not. It was not our problem. Our own was just to run it, to use it to do the test. So I believe is very cost effective. If you like you rightly said, you have to see that you actually need it. The need analysis must be done and see whether it's something that can be beneficial to you. Thank you.
Yeah. So just a follow-up question to you, just for the benefit of everyone. So you were able to enhance your services to your patients using that machine, and of course the hospital was charging for it. So the cost that the hospital was charging to the patients, was the hospital able to offset the payment to the outsourced providers based on the money collected from the patient?
Well, I think the agreement was, from whatever payments they get every month, it was a sharing formula, sort of.
It was a revenue share.
Yes.
Okay.
Yes.
Excellent. That's a great way of contracting then. Because then you would have shown to the company kind of the volume of patients that you get on a monthly basis, and there may be a minimum guarantee and then a revenue share. So that's a great way of managing this. Hats off. Great. So next, Dinda James, you have raised your hand. Please go on.
Yes, yeah, thank you, Sanjay. So, from my end, I see outsourcing as a cheaper way of procuring services. You look at what you need and whether or not you have the competence to be able to provide that service and all that it entails. Sometimes you outsource it to, um, most times, almost all the time, you outsource it to somebody who is a specialist in that area of providing that particular service. And he has the competence, he has the resources instead of capital investment in some of these items that you will require to provide their services, and then the personnel that you need to recruit. That person is providing you that service. And then when you look at the investment that you're supposed to put in there, you probably do not need it. So you outsource it and you're procuring that service which is being provided for you And so that gives you that service at a less cost, because when you look at what you need to invest and then maintain over time, and again, it's also dependent on whether or not the kind of activity you want done. Is it something you're looking at long-term investment? Is that something, is it a field that you want to specialize in? If it's not, you just need that ad hoc service to be provided. Outsourcing is the cheaper way to go. But if you want to go all hog capital investment, that's a different ballgame altogether. But it's more expensive to really want to provide the service yourself and invest in it. But if it's something that you need to just procure, it's cheaper to outsource. Thank you.
Excellent. Thanks for the great points, Linda Jane. Next, Dr. Kehinde.
Okay, thank you, Sanjay. So outsourcing helps an organization to face their core business, really. When you outsource some of the other areas, you are then able to face the core business and the areas where you have an expertise in. So if you look at, and we can outsource various things, companies that outsource the workforce, part of their workforce, on the short term, it may look like they're paying more. But then if you consider it on a long-term basis, they're actually making some savings. So it's cheaper for them because they don't now have to deal with some other allowances, severance, and all of that, as well as all the overhead costs of personnel management. So in that case, it's actually cheaper. So in essence, we need to consider the overall cost when you are comparing whether to outsource or not. I think actually in the short term, it may look like outsourcing is more expensive, whereas on the long term, when you factor in all the other costs in terms of including lost time and all of that, time that should have been spent on the core business that have been spent, for instance, in some states, the pharmacists have to travel from their facility to the state warehouse to pick up medications. So the time they should have been spending on for managing patients or for patient care, they are spending on the road and doing all of that. So I think on the long run, I think once you outsource to companies that have the expertise and are keeping to the terms of the contract and are delivering well, in terms of cost benefit, it's actually usually more beneficial. It has the cost effectiveness is more with outsourcing. In the Nigerian context also, if we're able to take out corruption from our equation in the public sector, it will be more cost effective because it's working very well in the private sector. Thank you.
Excellent. So Samuel Adekola, Dr. Kehinde has directly challenged what you said initially. You said for short term it may be cheaper, but long term may be more expensive. Dr. Kehinde has taken a very good example from a human resource perspective, and she's saying short term it may look more expensive, but if we are able to manage it over a long period of time, then it will definitely be cheaper, considering different types of costs that has to be managed when done in-house. Okay, so maybe both of you need to connect and decide from both of your point of view, because both point of views are correct depending on what example we take. Okay, but the most important thing here is to note is that, and Binda also talked about it, if there is a real requirement of in capital investment and there is money which is present and there is a real benefit for investing that money, then yes, probably in the long run, it may reap more benefits. But outsourcing is really, really helpful when that investment is not available. Okay. So you really don't want to spend too much on systems and processes when you know those systems and processes are already existing with some company who can provide just the service that you need. Okay. Abuche, over to you.
Okay, so thank you, Sanjay. So I'll go along with what most of the previous speakers have said concerning the labor costs that can be reduced as a result of outsourcing. But I just wanted to add that in certain situations where outsourcing might not be cheaper, for example, in instances where you don't have maybe locally available 3PLs or other firms that have the technical expertise to carry out the required role that you're intending to outsource. So in such situations, it's easier or it will be more effective in the long run to invest in it yourself as a result of maybe quality concerns that may arise when you outsource to a particular organization that does not have the particular skill set in terms of technical capacity to carry out the role that you're planning to outsource. Thank you, and over.
Yeah. Thanks, Abuche. You have raised a very valid point, and the more generic issue with respect to what you have said is the issue of continuity. Now, one of the key reasons why a lot of government organizations and a lot of organizations in general, they want to do things by themselves because of the issue of continuity. Because private organizations, they come and go, okay, and it is also not possible to have the same private organization be contracted every year, year on year. So your private contractors may keep on changing, and hence continuity may be a big problem. So why a lot of organizations still choose to invest in systems and process, regardless of that they are really, really capital intensive, just so that they can have continuity in operations. However, we can go back and learn from World Food Program how they still manage to keep continuity even when they keep on changing their providers every 12 months or sometimes even less than 12 months. The reason being their own systems and processes in-house are really, really strong. Okay. So to have continuity with service providers, what is required is to have a very strong system in-house, which I think now I don't remember who said, if there is no corruption, if your systems, in-house systems do not keep on changing, which I know in Nigeria does. With every election, your people change, the new person comes, he has a different vision or she has a different vision. They try to modify things, and then again a new person comes in. Sometimes even within those 5 years, 2 or 3 times systems change. So if in-house continuity is an issue, then of course it will be an issue to manage outsourced providers as well. Okay, so think of it, think of this issue as well, the issue of continuity, and hence in some cases outsourcing may not be a good option. And also, like Oguche mentioned, there may be certain areas where there is no expertise present, okay, locally. And if you want to bring expertise, offshore expertise, or in case of Nigeria, if a state doesn't have the expertise and they're bringing the provider from some other state, it may still be very expensive, okay, rather than doing it yourself. So all this boils down to the fact that this is needed. Whichever function that you want to outsource, it has to go through this cycle of assessment, needs analysis, assessment of the private sector market, a proper comprehensive procurement cycle, contract management, relationship management, and depending on that, continuation or exit and finding another supplier. If this is not done correctly, your outsourcing will never be successful. Okay, whichever way you look at it. Okay, so this is something which has to be thought about and managed in exactly this way, because you cannot cut corners in this process. Okay. So what's left? So what are some of the challenges to outsourcing? It can be quite challenging for many organizations because many organizations think that it leads to sense of loss of control, because now uh, a lot of things are dependent on the service provider. And if the service provider doesn't work, then a lot of organizations don't know how to manage it because their contract management systems are not good. So that always comes as a challenge. Communication can be a big challenge if you don't have a proper way of communication and coordinating with your suppliers. It may prove to be challenging. There may be some unforeseen and hidden costs, and this is what actually Dr. Samuel Adekola was talking about. Because every private company, their objective is to increase their bottom line. So if you don't manage your contracts properly, you may eventually find some hidden costs, from your suppliers, and you will have no way of finding out what you are paying for. Security risk, we talked about this. So depending on where the transportation or whatever service is being happening, if security is needed, then has to be added to your contracts. Very specific to health products is quality control. So whatever supplier that you select, they also have to adhere to the good storage and distribution practices. It is paramount, because if they're not transporting your vaccines or any cold chain products in through cold chain system, then you will have a problem. Okay. Uh, Managing service providers' failures. So this is a question of service levels. If you don't mention and enforce your service levels, that will be challenging. Difficulties in integration. Now, this is very important. Now, uh, there's a next slide here. Yeah, about Mozambique, which talks about integration. Now, integration, what this means. Let me give an example of transportation. So, let's say there is a warehouse from where products need to be transported to smaller stores, hospitals, or service delivery points. Okay. Now, the service provider has a routine that they can come with their vehicle at a certain point. They want to utilize X number of hours for loading, X number of hours for traveling to the distance, and then X number of hours for unloading. Okay. However, if your contract suggests that loading is a function that has to be managed by the warehouse staff, and the warehouse staff is not able to load everything based on the time which is prescribed by the provider, and probably that is a acceptable time, then there will be problem. The provider may charge you more because the trucks is sitting idle at your warehouse, or it is taking them more time in managing their entire cycle of distribution. So integration is very important, where the suppliers and the clients processes must match from time point of view, from efficiency point of view, from cost point of view, from everything. It has to match. If they don't match, there will be challenges, there will be cost overruns, and there will be issues. Okay. And finally, of course, lack of managing, lack of experience in managing provider staff. Okay. So the client staff, which in case the government, let's say, they need to know how to manage provider staff. And in large operations, generally what happens is the provider may have a few staff embedded into the client's organization as well. So which means that provider staff is actually doing a lot of work from or on behalf of the client as well. So that operation is more integrated and it works well. And when I talk about the case of India, this is exactly what really worked really well for them. Okay. So with this slide, I have a slide from Mozambique, which again comes from the outsourcing case studies which we had shared with you. So there, the central medical store, they always say that it costs more with the logistics provider than an in-house fleet, because the service level is poor. However, when they checked from the service provider, it was a different story. They say that the CMS takes a very long time in picking, packing, loading. The CMS always wants the trucks to be there when they want it, irrespective of whether their staff is ready to load the products or not. So the service provider, they don't want to send the trucks unless everything is ready. But CMS wants the trucks to be there whichever way, irrespective. So it's a standoff kind of between those two systems, because CMS has a way of working which is not very efficient. The private sector, they always want efficient ways of working because they are worried about their bottom lines. And that's where there is they need to strike a balance. And that's where the challenge lies. Okay. Because the CMS is not very disciplined, while the service provider, they don't want to lose money, where they can send the truck to some other operation while the truck is sitting idle at the CMS's warehouse. Okay. So these are some practical issues that are faced by organizations all over the world. Okay. So outsourcing looks easier, but managing that outsourcing may be really, really tough. Okay. So outsourcing, only go for outsourcing when you know you can manage it. Otherwise, you will face the same problems again. Okay. I think the next is the India. No, okay. So we have risk management, but let me quickly look at the time. We have about 20 minutes. So risk management is 1 and 2 slides. Okay. So risk management is simply, it's like any other risk management. So for any outsourcing operation, you must have a risk management plan, where you should have a plan if you feel loss of control, if you feel communication problems, if there are hidden costs, if there are security risks. So all the issues that you saw more or less here, so those can be turned into risks and can be managed accordingly. Okay. If you have quality control issues, failure to delivery, integration issues, lack of experience with managing providers team. So all this is written on the slide. It simply means that think of your challenges as risk and have a pre-planned plan or pre-planned activities to manage those risks. Okay, so if a certain thing comes up, you already have a plan to manage that. Okay, and then there are certain risks which you can do nothing about. Okay, you just have to accept it and move on. And there are certain risks which you can address or you can avoid. So it's a simple risk management plan, and it has to be done when you are thinking about outsourcing. Okay, so here we give some examples or ideas of how to do it, which you can read about. But I would like to talk about the India case study. So yesterday, Priyanka has shared a PDF file. So she has actually shared 3 things for this slide: the Gavi outsourcing case studies and the India case study. It's a very brief kind of a leaflet from Plan International, which Tokir had shared, because they are still working on a detailed case study from India. But let me give you a brief idea, because I was also working with the HIV/AIDS program for 2 years before this entire outsourcing operation started. So I was stationed there before. So I was not part of the outsourcing thing, but I was part of the entire supply chain team just before this. I will give you a context of where they were and where they have, arrived today. So in India, the HIV/AIDS program is still a parallel program. So everything else is integrated except the HIV/AIDS program, and it's very peculiar. For last 10 years, this discussion has been going on to integrate the HIV/AIDS program into the broader integrated health program scheme, which is run by the federal government, and then in the same line by the state governments. And India has a very similar structure that of Nigeria. So there is the federal government, and then each state, they're independent in managing their own health systems and health supply chain thereof. Now, HIV/AIDS system is entirely different. So there is a National AIDS Control Organization, which is linked with the federal government. And then every state, they have a body called State AIDS Control Society. Now, this entity, it is not linked with the State Ministry of Health. Legally, it is also not linked to the federal body of National AIDS Control Organization. So it is a very peculiar structure that they have created at a state level. I have no idea why. We have talked about this for many years, but it is as it is. I mean, there's no one is even trying to change it now. Now, the way it happens is, and when I was there, the way it used to happen was, the National AIDS Control Organization, it had two service providers who used to manage their procurement. Okay, so procurement was also outsourced. So they used to do the procurement for the National AIDS Control Organization. The commodities used to first go directly to a state warehouse, which was not linked to the state's AIDS Control Society. It used to be linked to the state general warehouse. Again, very peculiar arrangement. So from that warehouse, it used to come to the small store of State AIDS Control Society, and some had some bigger warehouses, some had some not so big warehouses, but they used to manage. And a lot of states used to struggle a lot because the State AIDS Control Society was not built to manage warehouses. It is more of a operational programmatic arm rather than managing supply chain. Okay, and they struggled for many years, many years. Okay, and now from that state AIDS control store or so-called warehouse, then it does or the primary healthcare center or secondary healthcare center, wherever they call it ART clinics, antiretroviral therapy clinics. So some clinics are standalone, some clinics are embedded within smaller to larger hospitals. Okay, so from the state's AIDS Control Society, they used to go to the service delivery point, and it was also mixed. In some cases, the state would send it. In some cases, the hospital or the service delivery point would come and pick it up. So it was really like a nothing arrangement. It was very ad hoc, and every other day they used to run into problems. In 2016, when I was working with them, so we worked in creating a national procurement and supply plan for AIDS because they still wanted to be parallel, which was then picked up by Plan International, and with the fund of Global Fund, they worked on a pan-India strategy. So now, currently, the process is like this. Procurement is still outsourced, but now there is a government organization. So now they are not outsourcing it to private organizations. The government itself has created an organization for public procurement, which manages procurement for all federal government health programs. And HIV has also come into that fold. So there's an organization called CMSS, Central Medical Store, something. They manage the national procurement for many products from HIV to TB to malaria and a few others. Okay. CMSS also has regional warehouses, and there are very large warehouses. These are like Amazon type warehouses. They are like extremely large. It can manage thousands, and I don't know. It's like very large. I don't even have units for that, but I've seen a couple of those warehouses, and they're extremely big warehouses with proper multi-level racking system, electric forklifts, properly laid out systems of warehouse management systems, everything electronic. So very good warehouses, and they have like about 8 or 10 of them across the country. So once procurement is done, products are directly shipped from manufacturers to that CMS's warehouse. Once the product reach the CMS's warehouse, that's when Plan International's role begins. So Plan International is a principal recipient funded by Global Fund, and they're supporting the AIDS program. What they have done, they have contracted two different service providers. I think now it's also become three. So initially they started with two, and I think now there are three of them. with those three providers, they're covering the entire country. And India is a very large country. So, one of them is covering probably the north and the central part. One of them is covering the eastern part, and the third one is covering the southern parts, south and central and south. So there are three providers, I believe. So whichever region that CMS's warehouse is, one of those providers, they will pick up from that, and they will directly take it to the hospital or the service delivery point. So they have literally removed that entire storing point of district or that state aid control society, which was actually the biggest issue in the HIV/AIDS program, because of which all the problems of stock out and inventory were happening. They have completely removed one level. So now from the regional warehouse, these service providers are picking the stuff, and based on the LMIS system, which is now available, and it is electronic LMIS, they're directly shipping the products to the hospitals and the ART centers or the diagnostic centers, which are linked with those hospitals. And if you see the document which we had shared, you will see that they have something like 99% on-time delivery and in full delivery ratio. Stockouts are barely occurring now. It's a daily operation. In the last interaction that I had with Tokir, he was saying something like some 1,000 deliveries are happening on a daily basis. 1,000 something deliveries are happening on a daily basis across the country. So you can imagine the scale of this operation, and it has been going on since 2019. So it's been 4 years now, I think, and it is still really good because it's been managed really well. So they Plan International, the idea what Tokir was supposed to talk about today was how Plan International and the National AIDS Control Organization went through all the steps that we studied theoretically, and all that they have gone through, in real time. So that is what he was supposed to talk about, but unfortunately he's away. We'll try to organize a webinar if possible later, and we'll invite everyone, not just Nigeria, but from other countries as well. But this is really something fantastic that has happened at a very large level. And I think, if I'm not wrong, Global Fund has commissioned a documentation for this. So maybe in a few months' time or sometime next year, there will be a large piece of document to study on how the HIV/AIDS program has pulled it off, and how it is also very cheap. There was no capital investment, there was no nothing. They used existing warehouses which were being already built by the government of India. How they integrated with that, how they removed one entire level of storage point from the HIV/AIDS program, and how they are able to maintain their delivery ratio, their very low stock out percentage, and how they are managing their inventory turnover. So I think all that will be part of that document, and if whenever that document comes, we will also try to share it with you. If you manage to speak to anyone who knows about this from Global Fund, or anyone you have any contacts in India, do study about this, because this is probably one of the biggest transportation exercise that is happening in any low or middle income country, or in any, let's say, a big program like an HIV or a vaccine or something. Okay. So that's a great case study. We would try to bring Tokir whenever he's available, whenever he's not working with Global Fund. The Global Fund is, how difficult it is to manage donors. We'll try our best again. But this is what we wanted to show you, that if it is possible in India, it is also possible in Nigeria. If not at a national level, probably at a state level, because at a state level, it may be a bit more easier. But the only thing that is needed is that cycle which I had shown you earlier. And also, the private sector of that state has to be capable in doing such an operation. Okay. And I believe in some states it is happening in Nigeria. If I'm not wrong, when I was working at PSA, and we had a project in Kaduna State and Niger State. I believe one of the states had a outsourced provider, and it was working very well. I don't remember which one was that, whether it was Kaduna or Niger, but one of them had. I believe it was Kaduna, if I'm not wrong. But I don't know what's happening today. It's been 3 years now. So it's possible, and I believe if done right, it can solve a lot of problems in the country's supply chain at various levels, but it has to be done in the right way. With that, this was the end of today's session. If you have any questions, comments, clarifications, we still have about 5 minutes. You can ask. You can also ask any questions with respect to India. I may or may not have the response because I'm not directly involved in that. But yes, I was part of the HIV/AIDS program just before this entire initiative started. So I'm just launching a poll in the meantime for the feedback for today's class. But if you have any questions, comments, clarifications, please don't hesitate to ask them right now in chat, or of course, I have been studying your responses on the Hive, and as much as possible, I'm trying to respond to those. Last week, I was not available, so that's why, Samuel, I was not able to respond to your message. I saw it when I was traveling. Then I thought of responding, but then I forgot it when I came back because there were so many other messages that had come up. But yes, I read your message and it's okay. I think you have still a lot of time to complete your program, and we always value your contributions in the class and on the platform as well. So great job, everyone. I really, really appreciate everyone going on the platform and writing down your opinions. That's really, really great to see. That is exactly what we wanted to achieve with the social learning system that we have set up for you. I know in some cases there are some small technical issues and glitches that you find. We are still a very, very new organization. We're just 3 years old. We keep on trying to fix those issues as they come along and try to prevent them from happening as well. Our systems have evolved a lot in the last 3 years, and hopefully, when you do another course with us, you will find less issues that you have found maybe this time. And hopefully, in a near future, we will just eliminate any kind of issues that you manage that you see. So with that, this was the final classroom session for this cohort. There will be one more session, but it will be the certification ceremony where we will hand out all the certificates, hear from everyone. We will also try to invite someone from the country to inspire you, to make sure that you keep on this journey of professional development. You keep on learning more and more as you go along. Doesn't matter which career level that you are, we always need to keep on learning. So with that, I have nothing more to say. Please, if you haven't looked at the poll, please do that. Like I said, when are you rolling out CS2? CS2 is available. We will be rolling it out shortly. It's just that we are still building up demand for that one. So probably in Nigeria, it will be happening next year. And whenever it happens, you all will get to know it. Keep checking your inboxes. We keep sending you emails. I will also again take you back to this if you were not there when I showed it initially. For all the women professionals, and not just for women, actually, for all the men. What poll are you referring to? Sorry, you can't see. Okay. Okay, so there is a rating for today's session. Dr. Olibikola, if you can just put down the rating on chat. Excellent, good, average, or poor. That will be great if you are not able to see it on your screen. But yeah, thank you so much, everyone else who have rated this session. So coming back to the slide, which I'm sharing now. For everyone, there is a great opportunity to join this interactive talk which is happening on the 25th of August. This is a new community that we are launching on Hive, especially focused on bringing up women leaders in health systems. Now, I'm not saying that we don't want men in health systems. That is not the objective. But the objective is that for women professionals to be able to find leadership roles, because this is something that globally we have seen a deficiency, that there are lots of women in the workforce, but when it comes to leadership, they are underrepresented. So our objective here is to create a community of professionals and leaders alike, where all of us jointly can learn strategies and opportunities which can guide you in your career and help you in your career progression towards leadership. Okay. This is a free talk, at least for now. As you see, it's a great panel that will be there. All these are leaders from different places. We may also have someone from Nigeria. We're still figuring that out. But these speakers are confirmed. It is a 2-hour event. They will share strategies from their own experience, their own personal stories, and we will also share some tips and guides as we go along. Dr. Olubaka, you have a question, comment?
Yes. Is this a one-off event, or because some of us already have previous engagements for that day? So
this event is, of course, this is the inaugural event. Of course, it will be recorded. But yeah, I mean, listening to a recording and joining the live version is slightly different. So if you have a commitment already, I mean, there's nothing we can do about it. But if you, everyone, please also disseminate it in your other networks for everyone else. We have lots of places, lots of seats for people to come. And we would really, really appreciate if you can share this in your own networks so that everyone can benefit. I will also quickly, let me show. Let me also just copy and paste the registration link in chat. So in case if you want to register right away, you can do that. But yes, the recording will be shared with everyone who registers. So even if you are not available to join on that particular day, do check out the page. Do join the community on Hive, because all of you are already Hive members. So it will literally take 10 seconds for you to join the community. And there will be more webinars and talks on this area in future. So if you join the community, you will stay informed of what's happening in this space. You can register even if you can't join this talk, then you will be shared the recording, and of course be part of the community so that you get to know what's happening in future. Okay, excellent. So if there are no other comments, questions, clarifications, I would like to close this session for today. I'm available on WhatsApp, and I try to respond to any questions, comments that come across. Last week I was traveling, so it was a bit difficult. But I'm back this week, so please do not hesitate to reach out to me. I try to respond to all my messages. Unlike Samuel, who is a bit sad that I did not respond to him. But Samuel, I have seen your message and I will respond to it as well. Okay, so with that,